Hello, my name is Justin Beard, and for my community nurse project, I chose the pain management nurse. So let's talk about some roles of the pain management nurse. The pain management nurse is a part of a multidisciplinary team that is helping individuals that suffer from chronic pain of some sort develop maximum quality of life. These individuals are typically your patients with degenerative joint disc disease, diabetic, neuropathy, that have suffered from a cerebral vascular accident, that have cancer pain, have been in motor vehicle accidents, have chronic headaches. All these individuals suffer from some sort of chronic pain, and what the pain management nurse does is they try to help them best develop the maximum quality of life that they can have. The second thing is to advocate for the patients so that way they can receive certain treatments as well as medications to help alleviate those symptoms of pain that they experience on a day-to-day life, because it really impedes upon their activities of daily living as well as their interactive activities of daily living. The third is to educate the patients as well as healthcare professionals on safe interventions and effective methods for pain control and analgesia. There are also pain management nurses. They're experts on understanding the signs and symptoms of pain in various types of populations. These would be your pediatric populations, your geriatric, those that are mentally challenged, and even individuals from other cultures, because pain is displayed differently amongst a variety of individuals based on their cultures and as well as the particular population they are of. They also conduct educational programs on conventional treatment plans for pain as well as supplementary or complementary modes of medicine for pain management. These are things such as like cold therapy, heat therapy, massage therapy, exercise, therapeutic music, ultrasound stimulation, using TENS units to stimulate the nerves in sites that are really tense. There are various modes of unconventional treatment for pain, acupuncture, and they develop educational programs not just for the conventional programs, but also the complementary or supplementary aids of treatment for pain management as well. The pain management nurse, they also administer pain medications via various routes, intrathecal, intravenous, as well as intramuscular, and they help the physicians do invasive pain management procedures. If you look at this picture right here, it seems like this nurse is assisting with a nerve block. So where do pain management nurses work? Well, they not only work in the hospitals, but they're out there working in the communities. Not everyone's going to the hospital that suffers from chronic pain. People live day to day with chronic pain, so they're out in the community able to assist those. They're in rehab facilities, sports medicine clinics, nursing homes, outpatient clinics, private medical offices, and oncology centers. They're in a variety of places in the community. They're not just in the hospitals. I want to talk next a little bit about the opioid crisis. Let's take it back a little bit, because with pain management, they oftentimes do treat with opioids, oftentimes to manage a lot of individuals' pain. So I wanted to talk about this a little bit. This is very important. Looking at the opioid crisis back in the 1990s, the pharmaceutical companies discussed with the medical community about a lot of opioid narcotic medications for patient analgesia that are used to help reduce pain. They talked about how they weren't addictive products, and so that increased the amount of prescriptions of opioid medications and led to a lot of addiction from all the increased prescriptions that were being put out by medical professionals. So in 2017, the United States Department of Health and Human Services, they declared a public emergency, and they announced a 5-point strategy to combat the opioid crisis. Now, I'm not going to go into too much detail about this 5-point strategy, but I do have an image here to show you what the 5-point strategy to combat the opioid crisis is that the HHS developed in 2017. Here we have better addiction prevention, treatment, and recovery services, better data, better pain management, better targeting of overdose reducing drugs, and better research as well. And here as well, the HHS does have some pertinent statistics on the opioid crisis from 2016, just for your viewing pleasure. So going on to that about the opioid crisis, just last month in July, Florida actually passed a law to where now healthcare professionals can only prescribe for acute pain a 3-day prescription, and for very strict cases, they can provide a 7-day prescription for opioid medications. And also the healthcare professionals, along with the pharmacists, do have to reach out to the state database to gather and collect, not to gather and collect, but to view information and look at the history of the patient in which they're trying to prescribe for. So we really put our foot down on that because we really don't want to increase addiction, both for prescribed and non-prescribed narcotics, such as opioid medications, which are highly addictive. So going into that, the reason why I discuss that is I want to talk about teaching strategies for pain management nurses. Even though we're trying to combat that, and we did pass that new law as far as prescriptions, even for chronic pain sufferers, we still do want to educate them on substance abuse and narcotics and opioids that are used to treat their pain. And here are some of the teaching strategies I'd like to utilize, but also not just for that, just teaching strategies, helping them understand pain management by other means other than taking medications as well. First, I'd like to talk about assessing the patient health literacy. Get a baseline for what your patient knows, see what they understand about their underlying pathophysiology, the signs and symptoms that they feel, treatment plans they've had before, medications they've taken before, the side effects of some of the medications they've taken, what they understand about what they take. Try to get a general idea of what they know, so that way you know how much information you need to provide to them, and you know at what level. For example, if someone isn't very well educated, say they have a high school background or a college background, you don't want to be using very large terminology. You don't want to throw that at them. You want to be able to assess their level of knowledge, so that way you can fill in the gaps based off what they already know. If they're an individual that has a lot of family that works in the medical field, then you can use some of that terminology. And you may not need to inform them of too much on certain areas and aspects of treatment plans, the pathophysiology of the disease that they have, and things of that nature, just based off what they know. So it's really good to assess the patient's health literacy, see if they have an understanding of what they're going through, and then be able to fill in where necessary and educate them on areas that they need more education and focus on. Next, patient teach back. So after you've taught the patient, or you've gone over some information and educated them, you want them to teach you back. Have them go over the information you discussed with them and reinforce certain areas, and give them little hints, make references to certain areas that they're lacking on as far as teaching back to you. Don't just tell them right away what they forgot. Kind of try and help and aid them, so that way it'll facilitate them growing and retaining the information that you're giving them. So see if they can teach you back what you taught them. It'll really facilitate the process of education and growth and them dealing with their pain. And last, offer educational materials. They learned a lot there, but they're also going to forget a lot too. You need supplementary information for them to use at home. Give them some magnets, with websites or things of that nature. Give them some pamphlets, some DVDs, just some resources, some internet resources they can use at home, and other things if they like to read. Pamphlets will definitely help. Some magazines on how to control pain and things of that. Give them some of that information, so that way they can facilitate their knowledge and look more in depth on the information that they're trying to learn at home. Let's talk about educational requirements now to become board certified as a pain management nurse. Now, though it's not necessary for you to be board certified in pain management, it will assist with you finding a job in this field, as well as, in the specialty, as well as it'll allow you to develop a lot of the skills the education and knowledge for the experiences you'll be facing as a pain management nurse. So in order to become board certified as a pain management nurse, you have to have a current active RN license, have been practicing for at least 2 years full-time as a registered nurse. You need a nurse role that has some aspects of pain management nursing that looks at pain assessment and pain management. You need at least 2,000 hours prior to 3 years of applying and putting in your application to take the examination, at least 2,000 hours in that area of pain management. And last, you need at least 30 hours of continuing education in those 3 years, and half of them, 15 hours, need to be related to pain management. And this board certification is by the ANCC, the American Nurses Credentialing Center. So who do pain management nurses work with? Well, it really depends on the area that they're working in. So how I discussed like the various types of clinics and rehab facilities and things out in the community that pain management nurses work at, that'll ultimately determine who they're working with. If it's in the hospital, they may be working with nurse practitioners, physician's assistants, physicians. If they're working at, say, a chiropractor's office that specializes in patients suffering from pain from motor vehicle accidents, they may be working with chiropractors, osteopathic doctors, physical therapists, maybe occupational therapists. It all depends on the type of clinic and the facility that they're working at that ultimately determine the individuals that they're working with. But they would work with overall a variety of individuals: doctors, physicians assistants, nurse practitioners, PTs, OTs, and a lot of techs. So let's talk about the skills and abilities required to become a pain management nurse. So first, you need to be able to assess pain. You got to learn how to be able to assess the pain that your patient is experiencing and listen to them, listen to what they have to say. And that'll allow you to set up care plans, which you will evaluate and see if whether the treatment plans for your patient's pain are in fact effective. Next, you have to be adaptive and resourceful, because not everyone's going to want to be taking pain medication in order to treat their pain. Some people are from various other countries and cultures, and they don't want to take anything for pain. Some people are very stoic. Some people don't like to express pain because they see it as a sign of weakness. Some people like to do acupuncture. They'd rather have a massage. They'd rather do exercise and stretching. So you have to be adaptive and resourceful, get an understanding of the individual, so that way you can determine how to treat their pain. You also need to, what's really important is you do have to understand the science of things. You need to know the pharmacokinetics and the pharmacodynamics of the medications that you're going to be administering to your patients or that are going to be prescribed for your patient. You need to know the interactions that they're going to have with the medications that they're already taking at home for their other chronic illnesses, or if they're going to have any interactions with the diet that the patient has. If the patient has a history of substance abuse or alcohol abuse, you need to know that this patient can't be mixing certain medications with alcohol, because then they can have some very deleterious effects. Things can go very bad depending on what they're taking with their medications. You also need to know the side effects of certain medications, how it may interact with that patient based on their other illnesses or disease processes that they have. So you really need to know the pharmacokinetics, pharmacodynamics, and just understand the overall pharmacology of medications. And last, what's really important is you have to be a compassionate and empathic individual. A lot of these patients that are suffering from chronic pain, it's never completely gone, it's still there. And so along with that also comes emotional pain as well. You're not going to be able to alleviate all the physical pain that the individual is dealing with. So just being able to be compassionate and empathic towards this individual is really going to help them emotionally as well, because they're suffering from emotional pain too. So let's talk about what I found unique about the pain management nurse. Well, as first areas of work, I was initially only acquainted with them in the hospital. We usually consult them a lot for individuals in the ICU when we're starting them back on their home regimen for pain medication, or if we can't control them with the medications that we're giving them in the ICU, Sometimes the intensive care doctors or the residents, because I do work at a teaching hospital at Orange Park Medical Center, they won't feel comfortable with certain dosages or administering certain medications. So we'll oftentimes consult pain management, and they do a really good job of determining what works for a patient, though it is all by trial and error. So I didn't know that they worked in the various areas they worked in. I didn't know that they worked at a lot of outpatient places, but like I said before, a lot of these nurses, a lot of these individuals that suffer from chronic pain, they're not all